All right, Brad, this is a video of Rick Olderman.
Mm-hmm. Yeah, and Rick is a renowned PT. He has written many books on therapy. If you want to get information on some of what he does, I remember his name by, he's an older man. Older man.
He's younger than us.
Yeah, he is, but still, it makes me feel better to say older man. So that's his name, Olderman.
And he's a real master clinician.
Right. Excellent, excellent resource.
In this video, he's working with a real patient who had back pain for 6 years.
And he corrected it.
He shows some exercises, and she gets better right away.
Right away. It's fun to watch.
It's like a miracle.
Yeah, when you're a therapist and that happens, boy, you feel like a champ.
That's right.
Bob and Brad, the two most famous physical therapists on the internet.
All right, well, why don't you tell me a little bit about your back pain?
Sure.
And, you know, what's going on?
So I think I've been having back pain since I had kids. It started maybe 6 years ago and then got better, and then it got worse again after I had my second child. Typically, I feel a lot in my lower back and hips. Sometimes there's some upper back pain, like around my shoulders, that travels up into my neck. The low back especially. It can flare up when I'm picking up my kids. Sleep can bother it too. Sleep positions, I'm a stomach sleeper. Those are some of the main things. Okay. A lot of walking, if I'm kind of extra active, it can get bothered.
Pretty localized to your back. Mm-hmm. And is it central back, or is it more one side than the other?
It's low back, either in the middle or more towards my left
side. Mm-hmm. Okay. You know, I wrote a back pain during pregnancy book. And in it, I talk about why pregnancy sets women up for back pain. And you're going to be a classic example, I can tell right off the bat. But the body, did you have back pain during pregnancy?
Yes, especially with my first son. And it was all on my left side.
Yeah.
And never fully went away.
Yeah. So what happens is, the assumption is a lot of women have back pain during pregnancy. And then after they have their child, the back pain tends to go away. Mm-hmm. But what I show in the book is that the body doesn't go back to what it was prior to that pregnancy in terms of alignment issues.
Right.
And so that's probably what is going on with you, and we're going to see if we can solve that today. Okay. Does your back pain hurt, like if you're bending over or bending down? Is there something we can do to test it?
Yeah, I think like bending over, like tying a shoe or picking up a toy off the floor.
Okay, so let's go ahead and test that right now and see how that goes. So go ahead and stand up, and let's see if, you know, do whatever you need to do to maybe trigger the back pain, and so we can test it after.
Okay, so like kind of like that. It just feel the stretch into my back.
Got it. Mm-hmm. Okay. And what if you reach down with your left hand? Does that also, would that cause the left side to hurt? Or
yeah.
Because that's the bad side.
Yep.
Right?
Yeah.
And would you say that reaching down with your left hand is worse than the right side?
Surprisingly, it was the right side.
The right side. Mm-hmm. And that caused right-sided pain, not the left-sided.
Yep.
So what about bending and twisting? Would that, do you think that might? Why don't you just try? I don't want to make you hurt, but we want to be able to know whether we're helping.
Yeah.
Right? So go ahead and try something.
Like that?
Yeah, just try whatever you think might trigger that left side.
Okay, and that's not triggering the left side.
Okay.
Yeah, I can definitely feel it.
Okay, all right. So maybe that bend and twist to the right might be the one.
Yeah.
Okay, so what I'd like to do right off the bat, Emily, is just have you sit down here, and I'm going to ask you to scoot forward to the edge of the table, and I'm going to ask you to lie back on your back with your knees to your chest, and then hug your knees to your chest. Good. Now, does this feel comfortable for your back? This should feel actually quite good, does it?
It does.
Have you ever done this to help your back pain?
Yeah.
At all?
A little bit, yeah.
All right. So right now your back is flat, and what you're saying is that feels good for my back.
It does.
Okay. So what we're going to do is we're going to hold on to your right knee, and we're going to lower your left leg down. And as that left leg goes down, yes, just what you're doing, you're going to pull your right knee towards you. All right. Now, do you feel a stretch in the thigh here at all? Okay. Now, I don't want you to push the leg down. It should just be, you know, go down however it wants. But you'll notice that your knee is way out here to the side.
Yeah.
but you walk with your knee here.
Yep.
All right. Do you see how much tighter that's testing now?
Yeah.
That you have it where it's aligned with your hip?
Right.
This is ultimately where we want to do the stretch.
Okay.
But if that's painful for your knee at all, then you can let the knee move to the outside. It's up to you.
I think it's okay.
Okay, good.
There's definitely a stretch in my knee. Should I keep doing this?
If it's not a painful stretch, if it feels like, oh, yeah, that's nice.
I think it's okay.
Yeah, then you can keep that there.
Okay.
But if it does develop knee pain, then you can let the knee move to the
Okay.
outside. Okay? Then the second thing is, this is 90 degrees of bend, so you'll probably feel more stretch with that. Okay? So this is the first stretch, and then this right knee is keeping your back flat, which is what you're saying makes your back feel good.
Yep.
So we definitely don't want to arch the back when you're doing this. Okay? So now we're stretching this. Generally, we're going to hold this here for about a minute. And now that's been about a minute. So we're going to bring that up and then reset your back.
Okay.
And then when you're ready, you're going to go on the right side. So we're going to hold this for about a minute. And do you have a sense that one side is tighter than the other?
It definitely felt like my left side was tighter.
Yeah, I think so too. Okay, you feel okay after that? All right, let's go ahead and test that little bending down twist.
Okay. Yeah, it feels a little less like you're not feeling as much kind of shoot up into each side.
Good. All right. So that's a good start. So let's go into the next exercise. And so all we're looking for is just a gentle stretch in the hamstring here. You can lean forward as much as you feel comfortable. You don't have to lean forward that much, but knowing that your back feels better with it flexed like that, you know, this would probably feel like a good thing to do.
Yeah.
And then if you like, you can pull that toe back as well, and that'll get your calf in there a little bit. All of that matters in terms of the system of issues that are feeding your back.
How should I do this at home, like on a bed?
On a bed or a couch, a dining room table. Okay, and then we're gonna stand up and switch directions. Now, I'm just curious, does that feel different on one side versus the other, or do they feel about the same?
It's strange because this side feels tighter.
It looks a little tighter to me too. And this is one of the things that we uncover when we're doing these types of things, are these asymmetries that are combined to create pain on one side of the body more than the other. So there's some asymmetry in how you're using your body. Not so surprising given the fact that you have small kids that you carry on one hip more than the other, so forth. So if the left side is 100% loose, what was the right side compared to that left?
I would say like, it feels like 25%.
Less.
Or, well, like if this is at 100%, like fully loose, this is only like 25% loose.
That's a huge difference.
Yeah, it feels really different.
Wow, okay.
Yeah.
So this may be, we're gonna retest your pain. This may be a big deal for you.
Yeah.
And when we tested the two muscles in the front of your thighs, you felt that there was only a 25% difference between the two. Is that right?
Right.
Okay, so this is even bigger.
Yeah.
All right. Okay, let's go ahead and come on out of there. We're going to do our retest.
Yeah, I mean, it still feels better on my left. It actually kind of feels a little bit more loose now on my right too, like when I'm going over towards the left and stretching up through here.
Okay, so when we stretched the front of your thigh, that felt better for your back. And did the hamstrings make it even better than that?
I think so,
Okay.
yeah.
A little or a lot?
Probably like 75% better, so a lot, yeah.
So it looks like this hamstring problem is a big deal for you then.
And I think I've always been really tight in my hamstrings.
Yeah, and it may not be both hamstrings. It just may be your right hamstring.
That's interesting, yeah, because there was such a huge difference in this.
Huge difference. Oh, you know what I forgot to do is measure your pelvis and rib cage. Yeah, so your left pelvis is a little bit higher.
Okay.
And your rib cage is lower on that side.
Okay.
Okay, so what I'm going to ask you to do is hold on to those handles and step on the tube with both feet. And what we're going to do, Emily, is we're just going to have you just hold that up like that and just move one foot out 15 times. And try and do it without touching the floor. And the stance knee we want to be unlocked. Good, and the other side?
This one's very hard to do.
Kind of interesting, we're starting to...
It feels like this leg is much shorter.
Yeah, yeah. And I also want you to pay attention to the fact that when you're standing on your left side, your pelvis doesn't rotate. When you stand on your right side, you have to rotate your pelvis back in order to get that to work. So what I would like to see you do is try and do it without rotating. Even if your foot only moves a little bit, let's not let your body rotate.
Okay. So I want my hips facing forward. Okay.
There's some significant weakness in your right hip.
Yeah, it's pretty hard to do this.
Yes.
Yeah.
All right. So this is going to be a big deal for you.
Okay.
Yet another thing that's adding to this asymmetry in
Okay.
the usage, and that's why you're having pain just on one side, or at least
Mostly.
more on one side than the other. Okay?
Gotcha.
Surprisingly, we found tightness on your hamstring, right side, weakness on your right hip, and it's your left back that's feeling worse.
So am I overcompensating?
It
or
could be an
something?
overcompensation issue because this pelvis is higher on your left side and your rib cage is lower.
Yeah.
So usually this indicates a weakness on the left. But in your case, it's the opposite. It's a compensation, I think.
Okay.
All right? So this would be a good one for
Okay.
you. What I'd like you to do, this one we're going to do on the table. We're going to get you on your hands and knees on the table.
Okay.
And you're just going to face this way.
Okay.
All right. From here, you're just going to sit back on your heels. Good. And just slide your hands forward a little bit, and you'll feel that nice stretch in your back here. All right. And that should feel like a good thing. So is that painful at all to do? Okay, good. It should feel like, oh, that feels wonderful.
Yeah, it's a release.
Okay, great. So what we're going to have you do is walk both of your hands over here to the left. And you might feel more of a stretch here on the right rib cage.
Yeah, I definitely
Okay. Get a sense of that, Emily, because we're going to walk your hands over to the right side in just a second and compare the two sides. Okay. So there's that one. All right, go ahead and switch sides. And do you feel a difference between the two sides, or they feel symmetrical?
I mean, I definitely felt more of a stretch on my right side.
Okay. I think it's just starting to loosen up a little bit. When I watched you walk your hands over to the right side, it didn't seem like your hands moved as far to the right as you went to the left with both hands. And I think that's why you were feeling it more on the right side than the left. And now you're starting to get that left hand to go over there a little bit more. Yeah. Okay, then we're going to come back to the center and come back up. You okay with that? Okay, let's go ahead and stand up. Was that a difficult thing to do?
No, it was very easy.
Okay.
Yeah.
Did these feel stressful at all to you? Were you surprised by anything?
I think just surprised at how tight I am on the right side when I always think of the pain being on my left side. So
Yeah.
that was a big surprise.
Yeah. Yeah, so here's something that also came out with that is that the right hip is weaker than your left.
Yes, yeah,
Right?
and I definitely felt, and I still feel some of the stretches in my hip on that side.
A lot weaker than your left. So I think that would be something to focus on when you're doing this program, is to pay attention to those imbalances and fix those.
Yeah.
Because they're meaningful. They
Yeah.
take your pain away.
Yes.
And that didn't take us very long.
No.
At
no.
all.
Yeah, that was really easy.
Yeah. Okay. So this is another thing that's in the program. I wanted to show you a way that you can sleep on your stomach
Okay.
without hurting your back.
That would be great.
All right. So you just simply put a pillow underneath your chest.
Okay.
All right. So go ahead and try that. Lie down on your back or on your tummy.
Okay.
And so what the pillow is doing, we want the pillow to be up by the shoulders, and we want it to allow, we'll scoot it up there a little bit more. There we go. Because this allows the hip to flex, and therefore strain is taken off your back. All right? So I'm going to have you lie here for just a second, and so I see that you're bumping that left knee out to the side. And you're doing that, do you know why? Because your left thigh is tighter than your right side. Does that make sense? So you know to adjust that. You just don't know why. All right? So you can, you can put something underneath more on that left side if that makes you feel even better. All right, that's up to you. So we're going to, now that you've been there for about a minute, we're going to take the pillows away.
Okay.
And I want you to see what your back feels like without the pillows.
Yeah, that feels like
It just, you feel the
tweaked
instant
totally.
strain,
Yeah.
right? And then we put the pillows back again. And it immediately feels better.
yes, yeah.
And now you
That's
know
amazing.
why. All right. Any questions?
No, I think we covered it. I'm really excited to kind of figure out to know what's going on and be able to start working towards it.
Yeah, and literally, how many minutes did it take us?
Yeah, this was very fast.
Yeah.
And as a busy mom, I feel like it needs to be like that.
Yeah, exactly.
So.
Okay, great. Well,
Awesome.
thank you.
Thank you.
All right.
Okay.